Hey there, welcome to another week of Doctor Tell Me Why, and we make it through another week of 2020. I wonder how many weeks of 2020 are we going to get through. I suppose I've got to begin this week's show by apologizing for how I'm dressed today. I'm sorry I'm in my PJs. I'm feeling a little bit ill, a little bit under the weather, so I decided that I should do this show as comfortable as is humanly possible. But I actually think this is a pretty cool look, so leave me a comment below. Tell me whether you think I should keep this look for all my future videos. So this week's show is all about vitamin D, which I feel really needs some coverage from me because it has been in the media a lot lately, and as a result there has been a lot of information as well as a lot of misinformation about vitamin D, so we can clear up some of that misinformation. But before we begin, a message from our sponsors. I actually have no sponsors, so here is a message from me. If you want more great medical content like the video that's just about to come up, then you should definitely hit that subscribe button right now. Otherwise, you risk missing out on I don't know what. The misinformation actually begins with the name. Vitamin D is not actually a vitamin like vitamin A, B, and C. Vitamin D is actually a prohormone. What's a prohormone? A prohormone is a substance that your body can use to make hormones. It's a precursor to a hormone. And you probably already know a lot about vitamin D. You probably already know that vitamin D is important because it allows you to maintain healthy bones and healthy teeth. Vitamin D does that by allowing your body to absorb calcium from dietary sources. For example, if you didn't have enough vitamin D inside of you somewhere, your body would be unable to absorb calcium from things like eggs, milk, and cheese. Vitamin D also prevents you from peeing calcium out because it stimulates the reabsorption of calcium in your kidneys. Typically, when people are deficient in vitamin D for long periods of time, they also become deficient in calcium. And your body deals with that deficiency in calcium by mobilizing calcium from the storage systems it has for calcium, things like your bones. This can lead to a reduction in bone density, a condition known as osteoporosis. But vitamin D deficiency can also result in conditions known as rickets in children and another condition known as osteomyalgia in adults. Rickets and osteomyalgia are two conditions where the bones actually begin to soften. But new research has demonstrated that vitamin D may be a little bit more than that vitamin you need for healthy bones and teeth. More like a miracle supplement. A 2018 review of various different studies found that vitamin D played a protective role against infection with the influenza virus. This was independent of any other factors. And when depressed patients were given supplementation with vitamin D, they found a significant improvement in their symptoms. And a past review of 63 observational studies found that vitamin D may be important in preventing some sorts of cancers. Cancers like cancers of the colon and cancers of the breast. Most recently, vitamin D has been correlated with the new coronavirus SARS-CoV-2. One study found that vitamin D supplementation played a protective role against infection with the new coronavirus in pediatric populations. And this should not be entirely surprising. After all, the vitamin D receptor controls the expression of over 900 immune-related genes. In theory, these genes could then go on to encode for peptides that could have a microbicidal effect on infective organisms. In fact, it has been suggested that vitamin D could play an important role in recruiting neutrophils, monocytes, as well as T cells, your immune cells, to sites of active infection, and that it could also promote apoptosis of infected cells, apoptosis being programmed cell death. If a cell that is infected undergoes programmed cell death, it stops the cell from infecting other cells around it and thus contains the infection. So how can you make sure you're getting enough vitamin D? Well, we're actually in a really lucky position because for the most part, your body makes its own vitamin D. Sitting in direct sunlight for 20 to 30 minutes each and every day should ensure that your body is not deficient in vitamin D. But that's not the full story. The sunlight-dependent production of vitamin D is greatly affected by factors such as seasons, time of day, latitude, as well as your age and the color of your skin. In fact, an elderly person makes 75% less vitamin D when they are exposed to the same amount of sunshine as a young person. There are lots of symptoms of vitamin D deficiency, and they include things like fatigue, muscle pain, bone pain, back pain, getting sick all the time, as well as low mood and even hair loss. If you're concerned that you could be deficient in vitamin D, then you should definitely go and see your doctor. Your doctor can order a simple blood test that can check your levels of vitamin D. If you like this video, then please give it a thumbs up. Giving it a thumbs up tells YouTube that you would recommend YouTube recommending my content to other people. Basically, you think my content is worthwhile, which as a small YouTuber means the world to me. If you really loved this video, then you should definitely hit that subscribe button. That way you can keep tabs on all the great medical content I have lined up for you in the future. If you're still not convinced, then check out some of my past videos and maybe you'll change your mind then. See you next week then. And hopefully I will have recovered then. I think that's the dream. That's the dream.